Alzheimer's disease is the most common form of neurodegenerative dementia, but there are other types too: vascular dementia, frontotemporal dementia, dementia with Lewy bodies, among many others. However, by far, at least 60, 70, maybe even 75% of the time, Alzheimer's disease will be the diagnosis. So, how do we make a diagnosis? You can make a diagnosis pretty reasonably well, probably 80% of the time, just by clinical history alone, in a person that has progressive cognitive decline, most specifically progressive short-term memory loss. That also includes changes in behavior. And then once we do that, we go on to specific testing. So first, we want to do blood tests. Blood tests are important because we need to rule out people with vitamin deficiencies, such as B12. Maybe about 5, maybe 7 to 8% of the time, we find something in the blood that could be mimicking a dementia. We now have several ways to image the brain in a more precise way by using a very specific test called a PET scan, or positron emission tomography. We can order an amyloid scan to more definitively prove whether or not a person has Alzheimer's disease. When someone truly has Alzheimer's disease dementia, there are currently only a handful of FDA-approved drugs. Two categories include cholinesterase inhibitors, an NMDA antagonist medication, also non-pharmacologic approaches, whether it's exercise or dietary changes or sleep hygiene or behavioral modifications, cognitive training, music therapy, the list goes on and on. So in summary, Alzheimer's disease is the most common form of dementia, but not all dementias are Alzheimer's disease.